Hello, I'm Micah Hill, the Interactive Editor-in-Chief for Fertility and Sterility. We are here with John Amory from the University of Washington. He has a plenary talk today at ASRM on male contraceptive, the past, the future, the present.
Exactly.
John, tell us what your talk's going to be about.
Super. Well, as you mentioned, the theme for the meeting is the past, present, and future. So I'm going to cover male contraception. So I'm a history buff, so I don't mind talking about the past. Going all the way back to the Bible, I'm going to bring up withdrawal, and then the introduction of condoms in the 15th century in Europe. And then we'll talk about vasectomy, which was introduced about 100 years ago, and that's kind of where the development stopped. And so the second half of the talk is going to be discussions about efforts to develop novel male contraceptives. So we'll talk both about hormonal approaches, which have been fairly widely tested, and then some of the work that we're doing in trying to develop non-hormonal male contraceptives.
Fantastic. So what do you think is the most likely future scenario 20 years from now? What's going to be the picture?
It's a great question. For a long time, we thought that hormonal contraceptives would be first to market. There's a nice precedent for them. Obviously, the female contraceptives rely on hormones to suppress ovulation. Analogously, male hormones can suppress spermatogenesis. The problem has been they don't do it all the time. They don't do it as reliably as we want them to. And then there's the issue of side effects. So those things have kind of slowed progress in the field. People, including our group at the University of Washington, are still doing clinical trials with hormones. Okay. And it is possible that something will come out that works. Contraception is interesting because it can't just work 90% of the time. Right. It needs to work 99% of the time for couples to feel confident to rely on it. And then the issue of side effects is not trivial. Right. I'm sure many of the listeners are aware that one of the most prominent trials in the area, sponsored by the World Health Organization, using injections of testosterone and a progestin, had to be stopped early because of severe mood effects, including one suicide. So that has sort of cast a little bit of a pall over the field of hormonal approaches, which is one of the reasons our group has started to look at non-hormonal approaches. Okay. And I'll spend a little bit of the time talking about that. Anybody who knows anything about sperm production can come up with 100 potential ways to stop making sperm, interfere with sperm maturation, interfere with sperm function or fertilization. Obviously, I can't cover all of that in one plenary, but what I wanted to share with the audience was just an insight into the breadth of the potential targets, and then focus for the last 10 minutes on the work that our group is doing, kind of revitalizing this area of developing inhibitors of vitamin A function in the testis. Okay. And this is sort of a surprise to many people. When they go to medical school or they get their PhD, they learn that vitamin A is important in vision, which it certainly is. Yeah. But what they don't know is that if you make an animal vitamin A deficient, two things happen. It loses night vision, and it gets male factor infertility. Okay. Because vitamin A is absolutely necessary for sperm production. Yeah. And it's more elegant than that, actually. The vitamin A that we ingest in our diet travels to the testis and is converted in situ into something called retinoic acid, which is the main effector of vitamin A activity. Right. And the testis regulates the amount of retinoic acid it produces locally. Okay. So one fun experiment, they did this about 20 years ago, they gave people radiolabeled retinoic acid and saw where it went. Yeah. It goes everywhere in the body except the testis. Okay. The retinoic acid, if you ate retinoic acid, it can't get into the testis because the testis is protected from retinoic acid. It wants to regulate its own production. Okay. And so the contraceptive goal is to develop drugs that specifically inhibit the conversion of vitamin A to retinoic acid in the testis. Okay. And it turns out that there's a very old drug that does that. And so we've been using that as a prototype and trying to develop novel.
And it only targets the testis, that conversion in the testis.
That's the problem.
So you don't have systemic effects.
The old drug does not just target the testis. And so you can see that the goal of the work is to preserve the contraceptive function of the old drug, but improve its specificity so that it doesn't interfere with functions elsewhere. Right.
Sounds like a fascinating plenary.
Well, that's the dream. And anybody wants the slides, I'm happy to share them. And yeah,
fantastic. Well, we look forward to it, and thank you for sharing what the talk's about with fertility and sterility, and congratulations.
My pleasure. Thank you so much.